everyone. Thank you for being here. My name is Berenice Aguilar, and I'm going to introduce you to Dr. Yanis Kyriasanos. He was born in Athens, Greece. He completed his basic studies at Thessaloniki University Faculty of Medicine, and as a military doctor, he also graduated from the Military Officers School, continuing his activity in the ranks of the Hellenic Navy. As an associate scientist of the Department of Surgery of the University of Athens, he trained in biliary, liver, and pancreatic surgery at the University Hospital of Athens, Attiko, under the direction of the Professor K. Vasilis Smirniotis. In addition, he has published papers in a significant number of international and Greek scientific journals, as well as participated in a large number of national and international conferences. So please welcome Dr. Yanis Kyriasanos, and we are here to listen to your lecture.
Okay, hello everybody. Now I will try to share my screen and to have, let's say, 20 minutes together. I don't know if you can see my screen.
Yes, we can.
All right. All right. So, well, hello. I hope that you are okay down there. We are in the middle of a very difficult situation globally due to the pandemic of COVID-19. We are doing our best. I think that you are doing the same. And I would like to express my gratitude and thanks, many thanks to the organizing committee for this kind invitation. It is a great honor for me to participate in such big meeting. The topic that I have to discuss with you today is the use of plasma energy in HPB surgery, but I think that there are no so strict boundaries between subspecialties. So I feel that it is more convenient for me to talk about plasma energy use generally in the oncological surgery. So we know that HPB surgery is a difficult sport because hepatic surgery and as well pancreatic surgery is a technical challenge. It is very known, this phrase, eat when you can, sleep when you can, but don't mess with pancreas. The same is with the liver. You know that better than me. And that's why HPB surgery has developed as a discrete specialty within general surgery. Mainly due to the complexity. Advancements in surgery and of course in this special branch of HPB surgery was for this stage characterized by the introduction of new technologies which come from physics, and they incorporated in order to improve the diagnostic and therapeutic management of the patients. Who could imagine some years before that today we would talk about preoperative evaluation of liver lesions by 3D reconstruction, or about ICG molecular fluorescence imaging and abdominal surgery navigation technology. So all these new technologies, they give a push to the surgery, especially to the HPB surgery, and brought enormous benefits for the patients. One new arising technique is the physical plasma. What is the plasma? The plasma is known as the fourth state of matter. You know that, and it can be produced after gas exposure to a high temperature or in a high voltage electricity. Like these atoms can move very quickly. They have collisions between them, and after that, the electrons can find the opportunity to dissociate from the orbits and become free ions. These clouds, this mixture of free electrons and ions, is that we call plasma. And we know that because it is very popular in the nature. You know the cold mode of plasma, which is the aurora in the North Pole, but we also know the heat, the very hot mode of plasma, which is the sun, 99%, or even the universe, 99%. So due to this, plasma should be called the first maybe state of matter, because it is what all the states arise from, and that's why it is proposed this. Apart from natural plasma, we also know artificial plasma in everyday life, from lights that we use in our houses, from neon signs, from plasma globes, and also, of course, from the plasma televisions. Concerning its medical application, plasma was initially used based on thermal plasma, on hot modes of plasma energy. And due to this, it was used for precise target thermal necrotization of tissue in order to have a good hemostasis and to control hemorrhage from several kinds of tissues. We know this hot mode of plasma from several years in our everyday life, with lighting be the most common. And if we really want to discuss about this, please remember that in its natural first option, first coming, plasma is something that it is very hot and can burn everything. But since 1990, several technologies have been developed in order to produce a plasma with low temperature under atmospheric conditions. And this is that today we call cold atmospheric plasma. Why we need this? Because when we talk about cold plasma in medicine, we mean temperatures lower than 40 degrees Celsius. And it's very important to have this, let's say, tool in our hands, because cold atmospheric plasma can give us all the advantages and all the benefits of the plasma energy, but in a controlled manner, making this tool a very gentle tool that we can use it in very different situations in our everyday practice. Apex J plasma represents maybe a potential breakthrough, for me it is, in surgery, as it is the most innovative application of plasma technology, combining all the chemical and biological effects that we can have for plasma energy in a controllable and precise use. Let's try to find out why this is like that and how we can use it. We have one mode of the use of J plasma, and this first mode is the mode of the classical monopolar diathermy. This can be done with the blade activated, and like this you can use J plasma as a standard scalpel for incisions, biopsies, and cutting procedures. You can see that in these cases where we can try to resect all scars and to perform adhesiolysis in cases of peritoneal malignancies and peritoneal carcinomatosis. We can use it as a knife or as a monopolar diathermy. And we can use this not only in the subcutaneous fat tissue, as you can see here, but we can use it even further in the aponeurosis, or in the muscle. You can see here how easily can we cut the muscle without bleeding. We continue with this kind of use, with the use of the monopolar diathermy use, and of course, you are very familiar with this kind of use from the time that we can use J plasma to cut the glycan capsule or the superficial layers of liver tissue during the first steps of the procedure. But not only during this time, we can also proceed with the coagulation of the cut raw surface of the liver after the resection of the tumor. And of course, during the dissection of the liver parenchyma. It is well understood that we can use J plasma in this mode of monopolar diathermy with this way, but I believe that J plasma can give us some advantages over the other devices that they are doing the same thing. And this is why. This is because J plasma can produce a zone of tissue necrosis which is significantly shorter, smaller, thinner than the tissue necrosis produce other devices. Here we can see that the tissue necrosis can be only 2 millimeters in dense and vascular tissues such as the liver or the spleen or the kidney, and can increase to the 3 millimeters when we discuss about soft tissues like the lungs. To the contrary, another advantage of the J plasma use in this mode is that the necrosis zone will not be increased in depth independently of the time that we will use the J plasma on the surface of the tissue. These two advantages are very important because if we compare this with argon beam coagulation or with the tissue link, we can see that these machines create a significantly larger zone of tissue necrosis, and at the same time they create a focal damage to blood circulation which is under the necrotic zone. So if we have to choose one of the devices that can give us the less damage with the best result, I think that plasma is the best choice, and this can be done by leaving the surrounding tissue intact. It is very important because if we compare, you can see that J plasma here in the beginning can decrease the possibility of necrosis about 8 times if it is compared to the monopolar, the classical monopolar diathermy. And according to the tissue that we use it, that we can see that we can improve the result of necrosis 4 to 5 times according to the tissue that we have to manage. Not only the depth, but also the width of the thermal damage, it is less and minimum with the use of J plasma. So I think that we can understand why this fundamental use of the monopolar diathermy with the use of the blade technique J plasma, it is significantly better. But this is not the only advantage. The main advantage begins with the use of plasma and with the blade retracted. In this case, dissection and superficial coagulation with no scar is the main advantages of this device. And this is because of the creation of the production of this cloud that we described before from electrons and ions enriched with biologically and chemically reactive species. And these species, the most of them is reactive oxygen and nitrogen species. And you know better than me that this action does not stay to the superficial level of the tissue, but it is go down deep to the cells, the deeper layer of the tissues, and can produce significant results in the function of the cells, in the construction of the DNA, in the cell membranes, and all this together can differentiate significantly the cell cycle of the cells, the DNA procedure, the DNA condition in the cell, but of course the viability of the cell by the induction of apoptosis. Today, we can say that according to the results that we already know, and due to the reactive oxygen and species that they are produced with the plasma technology, we can use plasma in medicine for sterilization, disinfection, and decontamination. You can see the decrease in the number of microbes in these cultures after the plasma application. We can use plasma for the treatment of implants for biocompatibility, and you can see how plasma can create pores in the membranes of the cells. We can use plasma for wound healing, in dentistry, in pharmacology, and most importantly, we can apply this technology in plasma oncology. World Health Organization have recognized that cold atmospheric plasma induce apoptosis for cancer cells, so they can probably represent a less invasive and in cancer treatment with fewer side effects. And we can see that after 48 hours application in cancer cells, in culture of cancer cells, well, the dead cells are significantly more than alive. And we know that there are different ways and paths that they produce these anti-cancer results by the local induction of immunogenetic cell death, by the induction of systemic response. But the most important is that this kind of anti-cancer action is not only strong, it is also selective against the cancer cells and not the healthy normal cells. There are several explanations about all this, but I don't want to go deeper. I will stay just to, it is a matter of relation between the levels of reactive oxygen species and cancer. So what do we know up to the moment? We know that cold atmospheric plasma can give us bacterial decontamination, molecules that mean volatile organic compounds, small molecules like ammonia, nitrogen oxide, sterilization of medical equipment, and that means that probably we can have less predisposing factors for systematic inflammatory reaction and sepsis. And at the same time, from the time that we have treatment in chronic infected wounds and wound healing, that means that plasma can help us to have less morbidity, less hospital stay, and less cost for our patients. That's why research programs are still running, and they trying to improve all these indications for the use of plasma technology. And J-plasma has also an advantage, is this second kind of use. Why? Because if we compare the use of helium and oxygen that J-plasma uses with the argon or nitrogen that other devices use, we can see that with this combination, the production of reactive oxygen and nitrogen species is significant more, and the results are more effective and stronger. So we can say finally that we have a great modality in our hands with a significant combination of actions. But the advantages does not stop here. They proceed with the control coagulation from the time that we have just a little bit of heat, and at the same time all the chemical and biological positive effects of plasma administration. And most importantly, we have increased precision. Why? Because we have understand that the use of plasma and the productions of free radicals and cellular body dissociation is more effective, is more important when we are dealing with a tissue watery element which can be evaporated with the use of the plasma. Why is this so important? If we try to go just a little back and to compare the loose connective tissue with the dense connective tissue, we will see that one of the main differences is that in the loose connective tissue, you have a great amount of water in the ground substance, I mean in the matrix, that it is the base of the tissue. And that means that in the case that we try to use J plasma in aqueous media tissue, we can see that the result is the production of increased amount of reactive oxygen and nitrogen species, which is a result that facilitates dissection between the dense connective tissue and the loose connective tissue. And actually, what is the dense connective tissue is the surrounding of the vessels, nerves, and ureters, all these delicate structures that we like to conserve, to protect. And on the other hand, we have the loose connective tissue that we like to separate, we like to dissect, which is the supporting matrix in order to identify the structures that I described before. So if we imagine that our surgery is a slalom between the dense and the loose connective tissue, we can understand why J plasma is the best device to try to do this surfing around these two different qualities of connective tissue. And you can see here how we can do this by the dissection of peritoneum, which can be very easily detached from the anterior abdominal wall with the use of the J plasma. It is a thin membrane, and sometimes it is very difficult, you know that better than me, to be separated from the abdominal wall. But with the use of J plasma, we can do it quickly and easily, not only avoiding the damage to the other structures, but at the same time by keeping the peritoneum intact. It was so fast and so convenient to work with J plasma in this kind of dissection that and at the same time we could separate and we could protect all these vital structures like the vessels. Here you can see the gonadal vessels and the ureter, another ureter here, that finally it was possible to prepare the whole peritoneum detached by the abdominal wall intact without opening. And you can see that from different options here, and also with the old scar attached to these peritoneal caps. And because the shape gave us the idea of the cocoon, we published this technique just the last August under the title Total Extraperitoneal Access for Parietal Peritonectomy for Peritoneal Surface Malignancy. And we gave the cocoon technique the name to this technique. J plasma help us to identify all these vital structures without have problems. And you can see how useful is in the use of in the loose connective tissue, which, as I said before, it is rich in water, and evaporation of these water elements can give us a very quick and safe dissection with the plasma mode. You can see here, these videos are just a little long, and here you can see how we try to separate not the parietal, but the splagnic peritoneum, the peritoneum from the mesocolon, which is unfortunately this patient full of peritoneal metastasis here. You can see how, this is not small bowel, of course, this is wrong, and you can see how close to the bowel we can walk, and so, and with so secure, safe, and fast procedure. We can deal with the benign small bowel adhesions. You can see here how we can change from one mode to the other, from the monopolar coagulation to the plasma mode use. So it is very good to have this device in your hands because you feel free and you can walk quickly. But also in malignant small bowel adhesions where the situation is more difficult due to the situation that has been created by the deposits, the malignant deposits. Here you can see my colleague is trying to cut this with the scissor, and there is also possibility to cut the bowel wall, but with the plasma it is very easy to separate and to proceed. If we go just a little deeper, I will need about 2 minutes more just to give you an idea how we can use the J plasma in bursectomy and omentum resection in cases with gastric cancer. You can see how easily you can detach the bursa from the mesocolon, working so close to the colon, but without damage the wall of the colon. Here we are just a little deeper inside the omental bursa, the separation of the anterior leaf peritoneum from the transverse mesocolon. The pancreas capsule, if you continue to separate the retroperitoneal space in the omental bursas, you will come just above the anterior surface of the pancreas, and here is where you have to take care about the parenchyma of the pancreas. Here you can see some deposits. These are malignant deposits on the retroperitoneal sac that we are trying to dissect. Underneath here, you understand. Of course, you know that this here is the pancreas. It is a surfing, as I said. It is a condition when you are using the J plasma device as a feeder and you are trying to detach all this tissue from the vital structures that you would like to prevent, to preserve. Of course, near the duodenum, the celiac artery is an area we can use it in gastric cancer cases. We can work so close to the duodenum without any fear that we can produce any damage to the abdominal wall or to the pancreatic capsule or to the structures in the hepatoduodenal ligament. The Kocher maneuver in a duodenal cancer, it has been marked with ink. That's why the whole area is dark. Okay, this is, here we can palpate the head, it's the pancreas. We are very familiar with all these maneuvers and manipulations. Of course, in the dissection of the lymph nodes in the hepatoduodenal ligament, in case of gastric cancer, in the case that we have to have a lymph node dissection. We can do it safely, rapidly, and bloodless. Okay, the truth is that this video is not so representative. Hepatic artery dissection near, and of course, near the portal vein. I said before that it is very good to use it in proximity with a small bowel because we can work very safely and very quickly. Again, here is a case where we try to resect the peritoneum in the small bowel mesentery. This is a case with colon liver detachment after a recurrence of gastric cancer.
Doctor, we have like 1 more minute.
Yeah, yes, I'm finishing.
Okay, thank you.
You can see how easily you can create layers between the tissue and to proceed with dissection because you feel safe and secure to go close to the bowel and go close to vital organs that with other devices you're afraid that you can harm. Let's see. Okay, this is a holocystectomy. It's not something very important, but you can use it in the soft tissue behind. The retrograde, anterograde, and of course the splenic artery dissection in pancreas and NOCA. You can see here the splenic artery. Here we are trying to improve our dissection in the hepatoduodenal ligament. Well, I don't have anything else to tell you. I feel that this is a small evidence that J plasma and the plasma technology, generally speaking, can be very safely and quickly be used in oncologic surgery and AHPB surgery because give us the advantage of two different modes at the same device, the classical monopolar diathermy and the J plasma dissecting mode, with an anti-cancer result, with the safety for the wall of the vital structures that we would like to preserve. This can give us a fast and meticulous dissection with good results for the patient and the ecological result of our operation. Thank you very much. Sorry for the videos. They were not so good created, but okay, we are doing our best and we will continue. Thank you so much for everything.
Thank you, doctor. We are recording this call. I don't know if the questions would get you later. And I don't know if someone of the organization is here. Okay, so they tell me like the questions would be sent to you if you agree.
Right. Oh yes, of course. In my email, you mean?
Yes, yes, because of the time. But thank you very much, and we hope to see you next time. Yeah.
Thank you so much for your patience and your support. Thank you very much for everything. Have a nice day and be safe. Okay.
Thank you.
Thank you. Bye bye. Bye bye.